Good evening, colleagues. I hope you can hear me. Can you hear me, colleagues? Anybody?
Yes, you can hear you.
All right. Thank you. Good evening, colleagues. I'm Dr. David Mkwanazi, an occupational and travel medical practitioner, exposure scientist, and health professions educator. But most importantly, I'm a colleague of yours. As always, my role today is to represent the Occupational Health and Exposure Sciences Academy as it aims to save workers and empower employers by enriching you, the occupational health professional, with knowledge. Today's session is proudly brought to you by Occupational Health and Exposure Sciences Academy in partnership with Meller Mediators. Let's just go through some house rules, colleagues. This session is accredited for one ethical CPD point by HPCSA by HPCSA and for South African Nursing Council registered participants. SANC attendees should contact Lebohan to guide them on how to upload their points. The CPD point will be allocated to the colleagues who have paid the administration fee, and colleagues still have the opportunity to finalize that with Lebohan before we submit to the HPCSA. Colleagues who do not wish to receive these points are welcome to attend this session for free to enrich their knowledge. Kindly please drop your HPCSA number or professional registration number with full names and email address in the chat box to register for CPDs and your attendance. For those who are not registered with HPCSA and Nursing Council, an attendance certificate will be issued to demonstrate your growing knowledge capacity in areas covered by our platform. Please keep yourself muted at all times to avoid interrupting the presenters. Disruptive attendees will be removed from the webinar and will not be able to join again. This session's attendance will be monitored for its entire duration to ensure full attendance. Kindly please ensure that you do not join using nicknames or handset device names to be properly identified and allocated your points. Each session will be podcasted on YouTube for long-term education and training purposes. We have realized that many colleagues go back to our YouTube page to recap on the information that may have been missed during the session. We also urge you to post your questions on the video platform to continue empowering colleagues who will always be able to access your our learning material and your questions. The link that you have used to join this session is a recurring link and can be used every month on the last Thursday of the month until the end of the year. Participants will be allowed to ask questions at the end of the session. Questions can be posted in the chat box anytime during and or after the presentation. Our sessions are multidisciplinary in nature and meant to empower colleagues from different professional backgrounds. Kindly please be patient during moments when we discuss topics that may not be relevant to you, but others. Okay, colleagues, some of you have reached out and said you don't want to pay an admin fee and we should work out a package for CPD registrations or CPD provision. So we hereby introduce these two packages. The first package for the rest of the year, the remainder of the year, is 350, consists of 6 points in total. This will enable you to gain CPDs from attending our monthly Thursday webinars. I think we have about 6 remaining for the rest of the year. And then the second package costs 1,500. It enables you to watch our monthly refreshers, which consist of 3 CPD points, plus you get CPD points for free in Thursday sessions. So all in all, you will receive 24 CPDs in total by the end of the year. Allow me to remind you that on the 9th of May, we will repeat our executive medical surveillance refresher from 10 a.m. until 1 p.m. It will be a Saturday, I think next week Saturday, not this coming Saturday. And then the following Saturday, we'll have a fresh webinar on ergonomic medical surveillance, which will also be online, starting exactly at 9 a.m. until 12 p.m. And then, as usual, we'll have our last session for the month, which will be the Thursday webinar for an hour at 6 p.m. In this case, we'll be discussing technical aspects of performing spirometry in the workplace and occupational lung disease. And this will be, I think, on the 29th or 27th of May, 2026. Late in 2025, we started hearing that private practices had to comply with certain standards and that there would be compliance audits performed at various practices. Amongst some of the requirements mentioned, we heard that health and safety and health risk assessments were expected to take place. Well, we do not have to guess any longer, colleagues. Tonight, we are in the company of the people at the center of these audits and will leave this session with deeper understanding of exactly what is required of us. For the longest time, standards compliance audits were synonymous with government and private hospitals and never had anything to do with private medical practices or public and private clinics. This is despite the fact that majority of South African citizens use these facilities as the first point of contact in the value chain of health service provision, and most of them are never referred beyond these institutions to hospitals because they manage to get all the healthcare needs satisfied at this level. These institutions, together with occupational health clinics, provide access to primary and occupational health services to millions of South Africans and need to belong to a form of quality assurance system that ensures that these patients are treated under the highest ethical and professional standards of care. In their 2020 qualitative, exploratory, descriptive, and contextual research paper titled Reasons for Non-Compliance with Quality Standards and Primary Health Care Clinics in Ekurhuleni, South Africa, LJ Mogakwe, H. Ali, and NBD Magobe recommended the implementation of effective management practices that is necessary to ensure that clinic managers are actively involved in the decision-making process, which will improve their compliance with quality standards, implementation of effective functional support system, and allowing time for primary healthcare clinics to conduct meetings and feedback sessions. And lastly, they recommended allocation of adequate human, financial, and material resources in the healthcare setting to facilitate compliance with quality standards. Please join us this evening for this informative and insightful discussion. Welcome. So this is what we'll be discussing today. The Office of Health Standards Compliance Audits and Accreditation by I think it's called OHSC. To help us navigate through this subject, allow me to introduce Attorney Tanya Meller, who is an attorney and mediator by profession. She holds BCom Law, LLB, postgraduate diploma in business management and administration from University of Stellenbosch Business School, MBA and MBA. She's an attorney, a mediator, and a corporate legal operations consortium. Tanya Meller is currently the CLOC, Corporate Legal Operations Consortium of the Alliance of South African Independent Practitioners Association, ASAIPA, and the CEO of the ASAIPA Charity Foundation. She is also appointed as the CEO of Biocetics and the COO of the Ophthalmology Management Group, OMG, and one of the directors of the Day Hospital Association Group. So she's a very active player in the healthcare system. Prior to her appointment, she served as the COO, Chief Operating Officer of the Ophthalmology Clinic, and was invited by the South African Society of Cataract and Refractive Surgery Congress Committee as an ethical speaker on several occasions. She has a passion for law and medicine and delivers workshops to all general practitioners to assist them to become POPI Act compliant. Tanya Meller has also acted as a legal representative for her organizations, such as ASAIPA, in several submissions, such as submission of the National Health Insurance Bill to the Portfolio Committee of Health, as well as submissions of the amendment of the Pharmacy Act addressed to the Registrar of the South African Pharmacy Council. She also currently acts on the Mediation Help Desk Committee of ASAIPA and assists members of her association with Section 59 clawbacks instituted by medical aids. She is eager to utilize her skill and knowledge and completed her MBA in healthcare leadership in 2023 at University of Stellenbosch Business School, where she is also a current part-time lecturer. Tanya, are you here?
Yes, Doctor. Thank you so much.
I'm now going to give you the platform, and please turn on your video. I see your video is coming up.
Thanks, Doc.
All right. You may
15.
share your screen.
Perfect, Doc. I'm currently sharing.
Okay, let me stop sharing on my side. All right. I think you just need to go into the presentation mode, and then we are ready to go.
Thanks so much. Thank you, Doctor, for the introduction, and also thank you for the opportunity to address your association on a very important topic that we heard now from Doctor as well, that we know is on the way, and they are busy currently inspecting our practices. So I think it's very important to understand, first of all, as an introduction, what is OHSC, and also to understand what's the purpose of these inspections of the OHSC as well. So the OHSC stipulated very clear on their platform that the purpose of these inspections are to protect and promote the health and safety of users of healthcare services. Now, like Doctor also mentioned in the introduction, the OHSC have been inspected hospitals biannually. They have now moved into our GP settings and will inspect every single private practice in South Africa. Thereafter, they are planning to move into our specialist practices. So every single private practice will be investigated by the OHSC. Well, we know as on date that they have started inspections in the Eastern Cape end of last year. They are currently actively in Gauteng. We pick it up also with our SAIPA members, for our members, of course, submitting inquiries, that all our current inquiries are coming from the Gauteng area. How it works is basically the OHSC will allocate a team to a specific area. They will then pick up from back end all the relevant practices at that given area, and they will then send you a notice of inspection. This notice will come through per email, and they will notify you of your inspection date. We're going to speak around this point in one of our next slides as well. Now, why compliance matters to us as healthcare practitioners, it's a legal requirement under the National Health Act. So it's like POPI Act, we need to comply and we need to make sure that we are adhering to all the regulations of this regulations of OHSC. It also improves patient trust, safety, as well as service quality. Now, what is the role of the OHSC? It's there to ensure that a health establishment meets minimum quality standards. So it's there to not only review that you have all your relevant documentation that they want to see on your file on the day of inspection, but I also want to make sure that your facility where you deliver healthcare is also on standard. It's also there for the role and purpose of accountability for both the practitioner and the facility at the end of the day, and for practices to adhere to the regulations and norms. Now, on one of the next slides, we are going to speak around the registration. But an important point to mention here is that when you go and register on their platform, you will notice that all the information that we need to submit is relevant to your specific practice. Now, what will be the case if you have more than one healthcare practice or group practices, then of course you will need to go and register every single practice. Like I've mentioned, one step back, this inspection is relevant to your facility. So make sure that your facility is up to standard and you have all your relevant documentation. Now, we know by now that the OHSC have circulated their manual by mid last year. They have informed us that we now need to start to become prepared and OHSC compliant, and that they will start the inspections. So this was communicated a long time ago. I think on what we are picking up from our members is that everyone basically thought that it's going to be more time, that they are going to be allowed to be prepared for these inspections. And once we saw it coming through in the system end of last year, we now started to focus more on what we need to have ready in our practices. But reviewing the OHSC manual that was circulated, there was one prominent point that we could see, that the inspections will not only review our administrative department, but it will also review our clinical department. And in both admin and clinical, that they want to review and make sure that all's in order, we need to also tick boxes. Now, what is the boxes that we need to tick that looks similar to the admin department that they want to score, as well as the clinical? Basically, we need to implement our SOP documents, and that we're going to discuss also in the next few slides. What we also need to have is we need to go and implement logbooks in both clinical department and admin. We also need to have relevant posters in our patient waiting areas and within our facilities. And then, of course, one element of the inspection is that they will select interview sections on your employees on the day of inspection, and they will then ask Q&As to your employees to make sure that the content of your SOPs are true and correct, and that is the processes that you are following in your practice. Now, what we've done is we took that manual and we basically went and reviewed what they want to score when they enter your practice for inspection. And we subdivided it into 5 domain groups. So when you go and review their basically merit of what they're going to score, it's subdivided in these 5 domain groups. So the first domain around patient rights, confidentiality, dignity, and informed consent. That's basically everything that I want to check on POPI Act regulations. Point number 2 as a scoring domain is around safety, security, infection prevention, and emergency protocols. So that's most of your clinical SOPs that you need to go and implement. And then the third domain is around clinical governance, quality of care, and record keeping, with the fourth domain speaking around your support services with all your third parties that you have SLA agreements on, for instance, your waste management and infrastructure. And then the last domain of scoring and review on the day of inspection is around management, leadership, policies, SOP, and training. So this is the whole manual divided into 5 domain groups as to how we need to prepare and know what they want to see when they arrive in our premises. Now, of course, step number 1 is where we now need to go and register. Now, the platform, the registration is a very easy process. When you go onto www.ohsc.org.za, you will notice that they will ask you relevant information to your facility. Of course, like I've already mentioned, if you have more than one facility, you will need to go and register every single facility for inspection. Now, the information that they will ask, like I've mentioned, please do have that on hand. If you're not going to register, please provide that to your management member to go and register. It's easy. It will take you 5 minutes. One question, however, what I receive in practice on a day-to-day basis is practices that will ask me, Tanya, do I go and register now? Or do I only go and register when I have implemented everything and I'm now ready for inspection? I would rather recommend to only go and register after you have worked through the manual of the OHSC and you do feel you are ready for inspection. But what happened this week is a practice contacted me and informed me, Tanya, I did not register, but I did receive my notice of inspection by email, and they are coming within a week and a half to come and inspect my practice. So even though if you have not registered, they can still pick your practice up, and again, they notify you that they will arrive on a certain time frame on a specific day at your practice. So very important, become prepared. It's reality. We also heard around the members or from meetings where we also attended that they have numbers that they need to reach as targets to inspect practices in certain areas. So this is really a reality we are seeing from our members on a day-to-day basis. Like I've mentioned, they are traveling with their team. So please go and prepare after tonight and get your practice ready. Now, step number 2 is where we focus more on how to prepare, what we need to review and become prepared now for the day of inspection. Now, this is where we go and review the documentation that we already have in practice and also go and review our policies. And if we don't have any policies or any SOP documents, this is a very important step to start at this point. Now, I referred already to SOPs, and what I do pick up in my training sessions is that I will refer to the term SOPs, but plenty of the members that sit in this training don't even know what the term stands for. So SOP stands for Standard of Operational Procedure. So the SOPs in both admin and clinical that is required that we need to have for the purpose of inspection in our OHSC inspection file is basically, in summary, they want to see that employees will know exactly how they need to act in a given circumstance that occur in our facility. So let me use the example. One of the SOPs that is seen as a very important SOP is that of the urgent care protocol. So if we do have, for instance, a patient that has a heart attack in our facility, both admin and clinical staff members need to know exactly what is our steps that we need to follow to act immediately on that circumstance. So very important, of course, if we employ new staff, we also need to share these documents and policies with them to review, understand, and acknowledge that they do understand the content and know what is required from them if an instance occurs, given the appointed position, that they will act accordingly. Now, point number 2 is patient care protocols, infection control, medication handling, and emergencies. Now, you will also notice as part of the inspection, you need to have SOP documents for your medication. On this medication review, what they want to see on the facility, they will ask you, doctor, please can you take us to the area where you store your medication? In that given area, they will review stock expiry dates to make sure that you control that. They will also review or ask you, how do you stock up your medication, or how does the process of reordering of medication works? Who's responsible in the practice for that? So that's also very important. And another thing is around our cold chain temperature medication, where we need to now implement a logbook, check temperature on the unit where we store cold chain medicine twice a day, 10 hours in between, to make sure that that unit is between 2 and 8 degrees. Now, again, there's a logbook template for that. So we will need to go and implement that in our practice. And again, we need to appoint that duty and responsibility to an employee in our facility to actually go and check that And from management, we need to go and review that it is being checked. Now, our point number 3 is around occupational health and safety policies. There's also a whole SOP around that. We also have a SOP that speaks around injury on duty. So if we have an employee that is injured within our facility, what is the report that we need to complete as proof and sign off and file back onto the employee's file? We also have a risk mitigation templates. So what they will require on the day of inspection, they will ask the practitioner, doctor, have you evaluated your practice? Have you identified any risk factors? We will hope that the answer is no. And then they will ask you, doctor, how will you act if you become aware of a risk factor in your practice? So there we have a mitigation plan template that we will then indicate, doctor, please indicate to them that this is the plan that you will follow, of course, to mitigate that a risk factor in your practice. Then point number 4 is around staff training, records, and competency certificates. One scoring element and point of the OHSC inspection is that you need to deliver proof and evidence that your staff members, together with yourself, have attended POPI Act OHSC training. So what we do on the side of millimeters, and I will speak around that at the end, we do conduct training sessions for practices directly, and then afterwards issue a certificate as proof that this practice has attended training and that you also file on your file because it's a scoring item that they want to see on the day of inspection. Then lastly, what we have on the screen is our incident reporting system. Now that's speaking around all our logbooks that we need to have in place. Like I've mentioned at the beginning of the session, both in our admin and our clinical departments, we need to now go and implement register logbooks and make sure that we do enter our entries in our logbooks. Now let's quickly run through a few examples of logbooks as part of the OHSC inspection, what they want to see. In our administrative department, there's a new logbook as a complaints and compliments logbook. So for every single time that we now receive a complaint or a compliment in our practice, we need to go and log it in that logbook. Another logbook that we have is that of maintenance of our equipment. So if we have equipment on our premises that we know we need to service frequently, or we need to calibrate these equipment, we also need to go and log it into our maintenance logbook. There's a template that we need to keep up to date. Another logbook that we need to attend to is that of decontamination and sterilization of our equipment. So for every single time that we now use instruments for invasive procedure and we need to clean it, we need to go and log in our logbook by the operator cleaner that we have cleaned these instruments in this given date and given time. So there's plenty of new logbooks. Again, immediately a doctor will tell me, but Tanya, that's plenty of new admin in our practices. Yes, we get the frustration from our members as well, but this is the intensiveness of our OHSC inspection for us to be prepared and make sure that our practices are up to standard. Now, step number 3 is where we now move in to prepare our practice. And most doctors will ask me, Tanya, but where do I start? I've read through the OHSC manual. I don't know where to start. So I will tell them, doctor, you've read now the manual. You have an idea of what is required. So what you would need to go and do now is go and conduct a self-assessment on your practice to determine what you already have in place and what you don't have in place. For instance, a good point to start is by drafting SOP documents. We know that only a few practices currently have SOP documents. It was never required. It's only now with the OHSC inspections that it's required to have as a must in our practices. So there we know the inspection is quite lengthy around that point. So I would recommend to a practice start there and start with the drafting of all your SOPs in both admin and clinical. But after that, of course, what we also need to do as point number 2, we need to ensure that our physical environment meets the requirements. So there's always also building compliance that we need to comply with. For instance, our consultation room doors must be in a workable condition. We cannot have broken windows on our premises. That's not seen as building compliance. So there's a whole list of building compliance that we need to check and make sure that all's in order. Also, some of the documents that we need to deliver during inspection is we need to deliver an electric certificate, the COC, as proof that this building is compliant electrically as well. So if you are, of course, a tenant to a building, you will ask this document from the management team for them to deliver a copy of that document. Or if you are the owner of that practice or that building, you will have that document somewhere because you had to receive that with transfer. Another building compliance is that of your fire extinguishers. You need to make sure that your fire extinguishers are service up to date. So if you are making use of an external company, please ask a proof of confirmation that all your fire extinguishers are also up to date. Another very important point while we are busy with printouts that we need to also file on our file is, of course, copy. If you are a dispensing licensed doctor, you need to print that out and your certificate and place that on your file. You also need to have a BLS certificate, believe it or not, but a doctor will need to deliver proof of a BLS certificate, basic life support certificate. Also, all your clinical staff must have a basic life support BLS certificate filed as well. Now, if you already have a BLS certificate, please go to review because that certificate is only valid for a 2-year period. And of course, if you need to renew it, please make sure that you do renew prior to your inspection date. Another certificate that you need to have on file is that of your HPCSA registration, that your status is active, you've paid everything, so please also file your HPCSA certificate as well as your BHF certificate is also very important. Now, point number 3 is what we already spoke on, check equipment calibration and maintenance log. So for all your big equipment, that being sonar machines, X-ray machines that you know you need to service and calibrate frequently, please attend to that and already schedule your service for that equipment well in advance. Another equipment that we are picking up with the current inspections that they require that needs to be serviced is that of an ECG device. So if you have purchases from a supplier, be in contact with them and hear from them where you can service that device as well. Point number 4 is around the implementation of infection prevention measures. That's all around your SOPs for your clinical department that you will need to go and study and make sure that it was in order as well. Point number 5, keep records easily accessible for inspectors. So on the day, know your practice. It's very important. They will ask you, please take me now to the emergency trolley. Then you need to know where is the emergency trolley. Or please take me to the area where you store your medication. They will basically walk through and want to see specific items. So know your practice, also know your file. That if they require a certain document, you can page to that document and you can indicate to them, they can score it, mark it off and move to the next item. What we picked up with one of our practices that went through inspection was that they had the emergency trolley on site, but unfortunately, the doctor could not attend to the inspection on site because he had to see patients. That's a very important point. They also alerted us in a meeting that if a doctor needs to attend to a patient immediately, the inspection can continue with management, or they will stop and wait for the doctor to first attend to the patient. Now, what happened in that instance of the example that I want to mention is that the doctor attended to the patient's need and the practice management continued with the inspection. But when they came to the point of the emergency trolley, the management member could not pinpoint out where the emergency trolley was. So what happened was they scored that practice as 0. So while the emergency trolley were on site, it was fully equipped. That practice scored 0 for that. So know your practice well, and of course, know your file also well and be prepared. Now, step number 4 is where we involved our team. We know by the interview sections that's going to take place on the day that our team members are going to play a very important role. So we will need to go and educate all our staff members about the important role that they will play in the day of inspection. I also recommend that a practice go and conduct a mock inspection in your facility. So after you have implemented your OHSC inspection file, go and conduct a mock inspection and also feel at ease that they can come and inspect your practice. Also, during this conduction of a mock inspection, I also always recommend to a practice conduct mock interview questions on your staff. Make them feel comfortable around the Q&A session as well. And then point number 3, assign compliance responsibilities. We know with the implementation of logbooks, there's going to be plenty of things that we need to keep up to date. So assign certain responsibilities to members in the team and encourage a culture of safety and accountability. Now, step number 5 is for me the most important slide, because this is usually where I receive most of my inquiries, is around what to expect on the inspection day. Now, very important, after you've now registered or not registered, you will then receive your notice per email, and they will notify you as follows. Kindly take note, doctor, that your inspection will take place, I'm just using example now, between the 1st of May and the 10th of May. Now, immediately you can hear that with the first communication, they're not going to specify a date. They are going to specify a framework, but not a specific date. Nearer to the time, this notification will come through about a week, week and a half prior to that time frame date. But nearer to the time, about a week prior to your inspection time frame, the main inspector will be in communication with you to confirm with you the exact day and time they will arrive at your premises. Now, when they arrive at your premises, everything is electronically. So they will walk in with a tablet. It's not a paper-based inspection, it's per tablet format. And there will be a minimum of 3 inspectors that will arrive at your facility. The first thing that you will do upon arrival is provide them with your OHSC file, and then they will review your documents that in your files, all your SOPs, logbooks, and all of that, and they will then review your registration. Like I've mentioned, if you have not registered as yet, they will then attend and take you through the registration, and that is where you will then continue into step number 2. Now, step number 2 is where they will assess the facility. So they will ask you, doctor, please, can you take us now to the emergency trolley? We know on the emergency trolley, there's certain items that needs to be ticked off. In the medication area, they will ask, doctor, please take me to the area where you store your medication. Please take me to the room where you store your linen. So you will need to guide them through the practice. After you have guided them through the practice, then they will go and review your patient waiting area. Now, in your patient waiting area, there's certain posters that must be visible. So please go and review the OHSC manual and take note of all the posters that must be there and what they will tick off. So they will then review the patient waiting area, and then they will select employees in the premises to conduct interview sessions and ask them Q&A questions. After they have conducted interview sections, they will then sit with doctor and provide doctor with a general feedback session, where they will give then general feedback around the experience and the inspection on site. Now, then one of 2 things can happen. So either they can issue doctor with an OHSC certificate confirming that you are compliant, or they can issue you with an OHSC report. Now, that report will highlight all the concerning items that they feel doctors' practice are non-compliant with. So the example that they use is that of a broken window. If they then highlight that that's not as per building compliance, they will highlight, doctor, this broken window in your consultation room is not per compliance. You will need to rectify that. What they will also provide to you is a contact email address and a platform logins, where you will then be allowed 10 working days from the day of inspection till the day of final report feedback will be 10 days, where you will then submit evidence. So let's take the broken window as example. In the 10 working days, you will, of course, repair the window, take a picture of the window, and upload the photo of that window as proof that you have rectified. When you have then submitted all your evidence and proof of the highlighted concerning items in that report. They will tick off every single box, and they will then issue you with your OHSC certificate. Now, when they issue you with your OHSC certificate, this certificate will be valid for a 4-year period. But it's not to say that they won't come and revisit you. So for everything that we're going to implement for purposes of OHSC inspection, we need to keep it up to date for if they come and revisit our practice. So on the day, be transparent, be cooperative, and have all the records ready. Now, common pitfalls to avoid during inspection is missing or outdated SOPs. We note that we need to review our SOPs on an annual basis. Another common pitfall is poor infection control practices if we do not adhere to our clinical SOPs. Another pitfall is incomplete patient records. What they will do is they will select free patient files to make sure that you do have POPI consent forms on those files. So please make sure that you do implement POPI consent forms also on every single patient file that you do have. Another common pitfall is non-functional safety equipment. If your equipment is not in a workable condition, or the last one, staff unaware of policy. So when they are asked interviewing questions, that they are just unable to answer them. Now, the benefits of being prepared is peace of mind during inspection, avoid costly penalties, improves patient satisfaction and trust, and a stronger practice management system, and a contribution to a safer healthcare system. Now, the current supports and resources available is, of course, their website, where we can go and visit. Everything is www.ohsc.org.za. This is also the platform where we will go and register. They will notify us of any amendments or updates on this platform. Also, keep a lookout for any professional and your professional association that will, of course, keep you up to date with any amendments, and also inform you of upcoming online training sessions to attend from your end. Consultants within the industry is like ourselves, mediators, where we assist doctors to customize their practice files for them. We make sure that we attend to all the SOPs, to all the posters, to all the logbooks. So if you want a third party to assist you, you're more than welcome to reach out to us. We are a legal firm that assists most of practices currently in South Africa to become compliant. So you're more than welcome also to reach out to us as consultants. Now, call to action after today is please go and register if you have not registered, or if you feel more comfortable to register after implementation, you're more than willing to do so. Begin implement compliance within your practice and engage your team while doing that, and always stay inspection ready. I think that's the most important. After you have received your compliance certificate, please continue to keep everything up to date. With that being said, Doctor, so I thank you and open up for any questions. Thank you.
Thank you very much, Tanya, and that was quite informative and mouthful. So while we wait for our colleague to post some questions, I have a question of my own. Let's say you do register on the website and you prepare yourself, everything that needs to be done, and you are ready for this inspection. What do you do next? Do you wait for somebody to come and inspect, or can you actually reach out and say, hey guys, I'm ready, come and inspect me?
Yeah, Doc. So I would actually recommend that the sooner we get that compliance, the better. We know it's the reality. So the sooner you feel comfortable and you feel that your practice is ready for inspection, I will do that. I will contact them and say that I have not received my notice as yet, but my practice is ready for inspection. Rather get it done and dusted with the practices that we have assisted. I think we have already assisted 120, if I'm correct, and that's now nationally. And the feedback that we receive from them, they say, well, it's not that stressful. We think it's stressful, but it takes about 2 hours in practice because we are prepared. We know what is waiting for us. So rather get that behind you. One thing that we've also heard from other parties is that just be in mind that there can be a possibility that medical aids will require that from practitioners, that you need to have your OHSC certificate, that you need to prove that you are on standard and your practice have went through the inspection. So I would rather recommend, if you feel you are ready with your file, rather reach out to them and set that up.
I do remember when you say that my indemnity insurer actually wanted an OHSC certificate, and I had to guarantee them that I no longer see patients in my practice and it's just an office.
Yeah, very important, Doc. On that point, while we are waiting for questions, we also assisted Genoa's members. So that's also medical insurance company. So all the insurance companies, please keep a lookout. I think they are going to request that you also deliver proof and certification. So I think the sooner the better, Doc.
Yes, I am with Genoa. So,
Okay, great.
one last question before I start reading out the questions I see they're coming up. There is an issue of private clinics, and recently I was faced with this question and I wasn't really sure how to answer it. Maybe you'll have more information about, our occupational clinics. Most of them are run by companies, let's say Simba or Coca-Cola. Just for an example, I'm not implying anything. You'll find that you are hired there as a doctor and possibly a nurse, but Simba or Nampec or whatever company it is has not registered the clinic as a healthcare facility with the Department of Health. What are the implications there? Are they supposed to register, or are they covered somehow by law, something like that?
It's a very important point that Dr. are mentioning there. The HPC's ethical guidelines was amended, I think it was already a year ago, if I can recall on time frame, that corporates can now employ healthcare providers. So that was a big change in the healthcare industry, that a corporate can now basically employ a doctor. And that is what we are seeing now in the industry. That guideline, as far as I'm aware, as on date, is currently under review. We are waiting for further feedback on that. But coming back to the point of the facility, like the examples that Dr. used, like a Coca-Cola or Simba, if that is the case, then I would, as a healthcare practitioner, actually be in discussion with management, because under that structure, if you're not licensed or basically registered, then there's big consequences that is not regulatory in order. So if you are practicing under a corporate that do not have the licensing, I would rather recommend to be in discussion with them, because the delivering of healthcare under structure like that is unethical at the end of the day.
Okay. Thank you very much, Tanya. The first question is from Galani. Can we get this presentation? Yes, the presentation will be posted on YouTube. Please reach out to Lebohang on the number that I gave you. She will send you the link to the YouTube page, and then you can view that together with all other webinars we've had under that page. And then from Dr. Fikiswa, do we also register occupational health clinics that belong to the employer? I think it's similar to the question I've just asked.
Yeah, registration is required, Doc. So please go and register. Make sure that your registration is also up to date. But yes, to confirm, yes, registration is needed.
All right. Thank you very much. The next one is from Rebone Mabua. What happens when you have received your certificate and you move your practice to a different location? Do you need to call again for a new inspection?
Yeah, it's a very important point that Dr. I'm mentioning there. When we sign our consent, we also consent that if any information on our side do amend or change, that we will notify the department or the OHSC. So very important, when you now move your practice, again, we note that the OHSC inspection is relevant to the facility. Of course, it's issued under the name of the healthcare practitioner, but they will need to come and revisit. What we know that they also mention is that after the first face-to-face inspection at your facility, they want to move the inspections to our online platform. So after your 4 years, then you will go and basically do our online submission. So I'm already thinking one step ahead. if you went through your physical inspection, if they moved this inspections with second inspections to online, then you will be able to basically do your own virtual inspection. And if they then pick up that there's any things that do not correlate, then they will come and revisit your practice. So the face-to-face will be the first inspection. If they're going to go ahead with the online, that was only as per our first discussions that we had with them, but they are predicting that this inspections after the 4 years is going to move online.
All right, thank you very much. The next one is from David Mahlangu. I was informed by a health inspector from the municipality that the practice needs to be registered with the municipality as a medical facility. Is this true?
Doc, I'm not aware and I'm too afraid to answer that question, but I can find out for Doc. So I think if the office can maybe share us with that inquiry from the doctor, I will definitely find out for Doc and confirm.
Okay, thank you. At this point, I'll invite our environmental health officer colleagues to post the answer in the chat box or maybe raise the hand and answer it for us, because I think they are the health inspectors. So in some municipalities, I know that your EHPs will be employed by the municipality. And I think when they come to inspect these practices, they expect for some kind of a registration to take place. But I don't think it's related to what we are talking about. It might be one of the bylaws or something that has to do with the health section of the municipality, I assume. May I please ask one of the environmental health officers to respond to this while we move on to the next question from Rebone Mabua again. What are the sanctions of non-compliance and timelines to correct the deficiencies?
So also a very important question that is being asked there. Like we know with the POPI Act, when they have inspected your premises and they highlight now the concerning items, they must provide you with a fair, reasonable time period to comply with these highlighted concerning items. Now, what we picked up with the practices that already went through inspection and have received the report, a reasonable time period, they have implemented this 10 days. However, that was at the beginning of the inspections. The inspections that we are seeing taking place now is a longer period that they do provide to the practitioners. So we are dealing now with practices that were allowed a month's period to be compliant. The only factor is that it must be reasonable. Now, after they have provided, they have inspected, that have issued a practice with a report, and they have provided a practice with a reasonable time period to be compliant, and they have highlighted the points of concern, then they can issue doctor with a final notice to confirm that we have communicated very clear, you were provided with a reasonable time period. We are now moving into final terms. That is where they will place you onto term and make sure that you are compliant, and then move into penalties. And that's also very clear with the POPI Act regulator, exactly similar process that they will follow. So they will definitely move into fining practices that stay non-compliant at the end of the day.
Thank you very much for that, Tanya. The next one is from Pat. Do you only inspect practices that are registered?
So, Doc, that's a tricky one. All the practices up until this week, or let's say end of last week, were practices who have registered. That I can confirm. I'm dealing now with a practice that I emergency had to attend to get their file ready, that has an inspection within a week and a half. And he confirmed to me, Tanya, I have not registered on their practice. Now, we heard from third parties that the OHSC has partnered with another third party, and I'm not going to mention a name here, that do sit with back-end data. So what we are seeing happening now in the industry is doctors that have not registered is also being sent notices of inspection. My first case was this week that I can confirm, where the doctor told me honestly, I did not register it, but I still received my notice of inspection. So I can see that they are definitely working on databases, picking up doctors in areas where they are currently active, and they will pick you up and send that notice. Only when you receive a notice, that is your confirmation of your inspection. Otherwise, practice has mentioned to me that they will receive a phone call. If you receive a phone call, request for your notice to be sent to you per email. And when you receive that email, that is your notification of your inspection. Now, doctors will also ask me, Tanya, what if the case is that I receive now that my inspection will take place on the 10th of May, but I'm maybe abroad. I'm not here in the country. Can I request for extension? Yes, you can communicate to them and say, kindly take note that I won't be available on that date, but you must give a valid reason. And of course, you must then propose alternative dates that is reasonable. So you can't now extend your inspection for 3 month period. That's not reasonable, but you can negotiate with them to, of course, extend your inspection. Now, I had also one practice where the extension was requested and not granted because it was too near to the inspection date. So please make sure when you receive the notice and you know that you won't be available on the date, that you communicate to them early so that you can get it extended.
All right. Thank you very much, Tanya. The last question from me is, when we were still new in the field, we were told and taught about, I think it's COSASA. So I've recently become aware that COSASA still exists. In fact, in 2024, we had invited them to our platform for a similar discussion like this. What is the difference between OHSC and COSASA? Do they work together or is it a different agency altogether?
Doctor, I'm going to now live. I need to answer that. I'm not sure what is the duties of COSASA that doctor are mentioning. I'm not sure. I know the OHSC is basically just there for the purpose of inspection to make sure that the facilities are up to standard, like I've mentioned in both hospital industry and GP now and moving into specialists. But I'm going to actually lie when I answer that one. But again, I can forward and we can find out what is their due role and responsibilities.
Okay, thank you. We'll appreciate that. And the last question for the evening, again from Pat. Can you request your service provider to be inspected?
Service provider, in a sense, the healthcare practitioner at the facility.
I'm thinking maybe the employer or something like that. I'm not sure. It's not very clear. Pat,
From
please.
which angle, yeah, we are requesting.
Pat, do you mind explaining the question? You can just unmute.
Thank you, Doc. Now I'm just referring like your a service provider that provides occupational health service to your company. Yeah, if maybe they are not registered, can you as a
As
employer
a
request that
client or as
the
employer.
service provider yes, as a client.
Okay. Do you
So I
understand
think
now, Tanya?
yeah. Yeah, thanks, Doc. So I think, Pat, very important is to go back after tonight's session and communicate to them the importance of being OHSC compliant. And of course, motivate to them the importance for them to go and register and of course start implementing and preparing them. But there's no force, like I said, that they will be picked up on back end. But I think from an employer's perspective, the best way will be is to go and motivate what is the importance to be compliant as soon as possible and not to be actually caught on back end and not be prepared, because when you're not prepared and you then receive your notice, you only have a week and a half to become prepared. So rather motivate for them to start early and have it ready.
Okay, Tanya, I think on behalf of colleagues, I can say thank you very much. Most of us did not even know about this OHSC compliance audits until today. And I'll be sure to forward some of the questions I'll receive in the group And thank you for your kind assistance. I don't think we're going to get as much information from anybody else. I would like to invite you to give us your final words before we close for the evening.
Thanks so much, Doc. Once again, thank you so much, everyone, for the opportunity to come and speak, educate, and share what's happening in the industry at the moment. Very important, OHSC must not be afraid. This is really, truly to the benefit of healthcare in South Africa to make sure that we get all our practices up to standard. So please don't see it as afraid. Rather, contact us so that we can guide you and work together with your association to get you compliant.
On that note, thank you very much. Colleagues, our next session will be on the 28th of May, when we will be discussing spirometry, the technical aspects and clinical aspects, and touching a little bit on occupational lung disease. On that note, I would like to say enjoy your evening until we meet again. Thank you.